One of the lessons we learned, and I was speaking about it in the hearing today, we should never again be in the position where we don't have medical equipment, where we're facing a pandemic, we're facing a major public health issue, and we don't even have basic equipment for nurses and doctors. And so much of it came from China, and governors such as myself are trying to figure out who do we know in China to get masks for nurses in our hospitals. I mean, it was terrible what we went through. It's a matter of national security.
Fellow Americans, our entire healthcare sector has been thrust into a war with an unknown and dangerous enemy named coronavirus. Our frontline healthcare workers are caring for patients without the needed supplies and are in a fight for their lives as they tirelessly and compassionately treat the very patients' viruses that could kill them. Healthcare personnel are currently being forced to reuse gloves, trash bags in lieu of isolation gowns, and wearing gallon-sized Ziploc bags on their faces as face shields. The truth is, all 50 states that make up our great union are attempting to source the very same stock that the entire world are attempting to acquire. The worldwide inventory is depleted, and importing the critical items rapidly is not realistic, and a lot of people will die as of the result. To make a change, we must act now. Domestic Medical Supply Coalition is a strategic alliance of owners and senior executives from the very industries the nation needs to join the battle to save lives. This group is working together around the clock and is galvanizing to renew our medical supply inventory through domestic production. DMS Coalition's mission is to spark the alliance of all Americans so that we can quickly pivot multiple industries to organize federally and demand immediate domestic production of all essential medical supplies. Please assist us in continuing our mission. Send this call to action to doctors, hospitals, politicians, manufacturers, suppliers, and anyone else who would like to help. We need all hands on deck to grow the movement and make a change.
U.S. stockpile is nearly depleted of PPE. Is that the case? And if so, how are
It
you planning to
is,
mitigate
because
that?
we're sending it directly to hospitals. We don't want it to come to the stockpile, because then we have to take it after it arrives and bring it to various states and hospitals. One of the things, and again, we ask the states to do this as much as possible. Many of the states have people that, whether it's that or clothing, they make clothing, lots of clothing in many of the different states. We said, see if you can get it directly from those manufacturers.
One of the things that this crisis has taught us, sir, is that we are dangerously over-dependent on a global supply chain. The Buy American order, which is going through process, would do a couple things. But if we learn anything from this crisis, it should be never again should we have to depend on the rest of the world for our essential medicines and countermeasures.